Doc on the Run. We help injured runners run. Today on the Doc on the Run podcast, we're talking about whether or not you should run when you're sick. For the past week, I've been sick. You can probably still hear it in my voice. And, I've had a fever, I've had a cough, I've had chills, a sore throat, some kind of sinus infection, poor sleep, and a serious lack of appetite. But don't worry, I'm not trying to feel sorry for myself, and don't think you should feel sorry for me either. It's just the way that it is. It's cold and flu season. And of course, one question that comes up this time of year when people get sick is, should I run when I'm sick or not? The obvious concern is that if you have a training schedule and a marathon on the calendar for the winter, then your fitness is going to suffer and you don't want to lose any ground. This is a valid concern. Obviously, if you stop training, it can wreck your run fitness and really interfere with your ability to finish your goal race on time. But you really have to understand something that seems to get lost on most sick runners in training. Not running when you're sick isn't nearly as bad as not running when you're injured. And there are lots of reasons for that we'll get into a little bit. But with that said, you have to realize there are lots of different proposed guidelines that I hear runners talk about that they think will use to help them decide if you can run when you feel sick, have a cold, or the flu. Things like, it's okay to run if the cold's only in your head. It's okay to run if the cold only lasts for 3 days. It's okay to run if you don't have any body aches. It's okay to run if you don't have a fever. Or it's okay to run if the cold isn't in your chest. I'm not going to comment or really give an opinion on any of the above recommendations or guidelines. It's not my area of expertise. I'm not an internal medicine doctor. I'm not a family practice doctor. My area of specialization is helping injured runners run in a way that decreases stress on the injured tissue enough that you can continue to heal. But with all that in mind, I will tell you how I think about running and training when you're sick. If you get a mild injury, and you wear a fracture walking boot for just a few days, that few days of really aggressive treatment can wipe out the injury, calm it down, and often allow you to get back to training in just a couple of days. But not wearing a boot and just decreasing your activity, trying to take it easy and using these sort of half-rest guidelines, that may actually keep you out of action for much, much longer, sometimes weeks. So if I have a fever, feel sick, I feel exhausted, I know I'm sleep deprived, I feel sleep deprived, I know I'm at risk of an injury if I really train hard. Now, my immune system at that point just isn't in a position to rebuild the tissue damage that comes as a consequence of a hard run or a regimented training session. When you are sick, the doctor always tells you to push the fluids. When we are sick, when we have a cough, a runny nose, anything like that, we can actually get a mild form of dehydration. And training in a dehydrated state can contribute to your risk of getting an overtraining injury. When we're sick, our appetite often suffers. If I'm undernourished, if I have not had a good appetite, and as a consequence I've not been eating well, then it just stands to reason that my body will actually lack the nutrients it needs to rebuild the tissue damage that comes as a normal consequence of running and training. So what does this all mean, and what do I really do? Well, if I am sick, sleep deprived, dehydrated, and run down, and I feel like I'm run down, I am not going to run. That is not going to help me get over the cold, and it is not really going to help me build fitness because you can't get over the cold and build fitness at the same time. If I'm sick and run down, I will focus on workouts, if you want to call them a workout, that include stretching and what I think of as flexibility training. I do not add additional work for my immune system to try to take care of. You cannot expect your body to cure a cold, clear the cough, and get rid of the sinus infection and recover from a hard workout or a long run. So, I've been sick, yes, and it's been awful. I have not enjoyed it, and I have not really been running. Yesterday morning, though, I ran 1 mile. Now, I didn't feel good. I probably shouldn't have even been running 1 mile. But to me, 1 mile is not a workout. But I want to heal as quickly as possible. I want to get over this cold as quickly as possible, and I want to get back to running as quickly as possible. So when you're in that situation, you should focus on the healing, focus on recovering, and getting better first, then run. Doc on the Run. We help injured runners run.